Hey, this is Katrina Bird, or my patients call me Dr. Bird. Welcome back to my channel. So, today we're going to talk about gonorrhea. So, if you're interested in what it is, what it does, and how to treat it, please stay tuned. All right, so today we're going to talk about gonorrhea. This is a gram stain with some gonorrhea in the background, so let's get started. All right, so I always think it's important to talk about the prevalence of the disease where we live. So we'll start with a little bit of epidemiology. So the darker the blue, this is a map of the United States. The darker the blue means the more cases of gonorrhea that's prevalent. So kind of in our kind of southern states, we have more cases than our northeastern states like Maine, Vermont, New Hampshire. So that's important when you're thinking about risk factors of if someone could possibly have gonorrhea. Next, it's always important to look at the age group. So this image is kind of divided in between the males and females. And as you see, kind of this 20 to 24-year-old group have the highest rates. And men in their late 20s are also closely behind in terms of rates. And for women, it's more that 15 to 19 year range that you have to be worried. So when you're thinking, could this person have gonorrhea? If they're in these age groups, you want to be more cautious and definitely screen young people around these ages. All right, so I love this picture. This came from the New York Post, I believe. So this represents, they're red to remind you that they're gram negative, and they're round to remind you that they're cocci. And they're in these pairs to remind you that gonorrhea is a gram negative diplococci. Its full name is Neisseria gonorrhea, and this is what it looks like when you do a gram stain. Additionally, one thing you should know, there are over 100 different types of serotypes of gonorrhea. So basically, one important key thing that they have is something called a pili. Pili are the most important virulence factors on the actual gonorrhea, and it mediates attachment of the bacteria to the mucosal cells. Additionally, there are many different types of pili, and we call those antigens when we're trying to create an antibody response against them. And because there are several different types of pili as well as outer membrane proteins, it can be very difficult for the body to mount a protective antibody response, because that's ultimately what we want. You get an infection, your body learns from that infection in the form of producing antibodies so that if you're exposed again, the antibody is able to block the infection so you don't get sick, or you don't have as bad of an infection. However, that doesn't really happen well when it comes to gonorrhea, because I'm telling you, the body has a difficult time mounting an immune response. So if you've had gonorrhea once, you're not really protected against it again, so people can get repeatedly infected with gonorrhea. And so it's really important to tell our patients that, and I'll put a link, that really think about ways in which they're going to protect themselves from getting sexually transmitted diseases. So let's move on. All right. So normal culture media nutrient agar contains things like trace metals and fatty acids, which can inhibit the growth of gonorrhea. Therefore, we sometimes use a chocolate agar, which is made of blood that's heated to 80 degrees Celsius, which in this process inactivates metals and fatty acids, making it possible to grow our Neisseria. This agar is used on sterile sites such as blood, because you're not supposed to have bacteria in the blood. So you can go ahead and put that on the plate to see if you have Neisseria in the blood. Okay, so now we have Thayer-Martin agar. This is a selective media, which basically means that it contains antibiotics and antifungals that will inhibit growth on this plate. So specifically, it has vancomycin, colistin, nystatin, which is an antifungal, trimethoprim. This suppresses the growth of any other stuff so that you will only grow Neisseria, gonorrhea, or Neisseria meningitis. This is important when you're trying to culture a non-sterile site. For example, if you have a cervical or urethral sample, there can be bacteria in the vagina or bacteria in the urethra that can also grow in this media, but because you have these antibiotics and antifungals in place, that growth of all of that other stuff will be suppressed. All right, so let's talk a little bit about cervicitis. So we want to go through a little bit basic anatomy. This is the vagina. This right here is a cervix, and this is a cross section of cervix. So when you go into get your pap smear, this is what your doctor is saying. And through the cervix, this is called the cervical os. When you go through the cervix, you go into the inner portion of the uterus. So this is a cross section of the uterus. And if you keep going up, you'll go into the fallopian tubes, and then you have your ovaries. So when we're talking about cervicitis, we're talking about infection of the cervix. Again, this is a cross section of the cervix. It's supposed to be pink, no discharge coming out the cervical os. However, when we have cervicitis or inflammation of the cervix, it becomes red. Some people may say it's friable, meaning that you kind of touch the cervix. It's painful to the patient. It could easily bleed, and you can have discharge. So if you have symptoms, they include vaginal discharge, pain with sex, bleeding after sex. And complications of having gonococcal infection of the cervix includes pelvic inflammatory disease or PID, disseminated infection of or ectopic pregnancy. So when we say disseminated infection, you can get this bacteria in the blood, and when it goes to the blood, it can go other places. Like you can get knee infection, so it can go into the joints. You can get skin lesions, so it can be really bad. All right, so let's talk a little bit more about PID or pelvic inflammatory disease. So again, this is a cross section of the female reproductive system. So again, vagina, cervix, cervical os, and the uterus, which even though it may not seem like, but there is opening between the uterus and the fallopian tubes and the ovaries. So when we're talking about pelvic inflammatory disease, it's caused by bacteria coming from the vagina, tracking through the cervical os, and infecting the uterus and or the fallopian tubes. So that is when we're talking about pelvic inflammatory disease. This is commonly caused by chlamydia and gonorrhea, and symptoms will include pain, like lower abdominal pain. You can have pain with having sex. You can have vaginal discharge. A lot of times people will have fever and overall feel unwell. Complications include ectopic pregnancy. So remember, I'm telling you, you can have infection in the fallopian tubes. So if this infection is left untreated, you could get scarring of the fallopian tubes. And if you remember, when it comes to pregnancy, let me just go back. So every month, when you have a cycle, if you were to get pregnant, right? Oh, let me just back up. So let's say you're trying to get pregnant. You have sex, semen goes up through the uterus and tries to meet an egg that's coming this way. Once the egg is fertilized, the fertilized egg will come to this upper back portion of the uterus. However, if you have scarring of the fallopian tube, the egg can't come from the ovary into the uterus. Additionally, the sperm can't go up into the fallopian tube. So that's specifically what happens, and basically you're unable to get pregnant because the sperm either can't get to the egg or the egg can't get to the sperm or get to the uterus. You can have ectopic pregnancy as a complication because the sperm is able to get up to the egg, but the egg has difficulty getting back down into the uterus where it's supposed to be. So the fertilized egg ends up staying in the fallopian tube, and it grows and grows and grows. And you see how small this fallopian tube is. It's not meant to carry a baby. So eventually a woman will have complications related to that. Lastly, you can have tubal ovarian abscess. So basically just a pocket of pus and infection in the ovaries or in the fallopian tubes. So we don't want any of that. All right. So next, you could get something called urethritis. So remember, the urethra is the tube that connects the bladder to the outside world. Here, these are the ureters, which are connected to the kidney. So urine is made in the kidney, goes down the ureters into the bladder, and then once the bladder is full, it empties out through the urethra. So when you're having infection here, symptoms can include pain when you pee as well as a mucoid discharge. Complications from gonococcal infection of the urethra includes dissemination again, meaning goes to other sites of the body like the blood, joints. You can have prostatitis in men and epididymitis in men. So I wanted to spend a little bit time talking about pharyngitis. So this is obviously somebody's mouth, tongue, uvula, tonsils back here. And, this is kind of the hard palate up here, soft palate down back here. And then just a kind of oral pharynx back there. So the one thing you should know is it is very common to get gonorrhoeal infection in the pharynx or in the back of the throat. However, I've treated many people with gonococcal infection in the back of the throat, and when I look there, the throat looks normal. It looks totally like this. This is a normal throat. So you should know that the majority of people with gonococcal pharyngitis have no symptoms. So it's really important that we as medical providers are screening people who are sexually active to screening them out if they say that they're having oral sex. Or you should just make it a normal practice because you never know. Like I said, in most cases, there are no symptoms. The throat actually looks very normal. All right, so how do you diagnose? So we use this nucleic acid amplification test or NAT. So I use the Optima test. So they give you this Q-tip, which I usually throw away because I usually don't use. And it's confusing for me and the patient. The actual Q-tip that you're going to use to obtain the specimen, it has this blue color and it's very small. So you use the swab to swab the back of the throat, the rectum, or the urethra or cervix, whichever site. You're only doing one site at a time. But whatever site you're doing, you're going to swab. You're going to unscrew the top, place this Q-tip into the liquid media. You're going to break it. There's like a little perforation. You're going to break it, and then you're going to replace this cap. And so it usually takes 24, 48 hours depending on your lab to get the results back. All right, so this is what you really need to be aware of. So the CDC has updated its guidance for gonococcal infection. So when we're treating urethritis, cervicitis, all those good things, pharyngeal infection, for gonorrhea, the old recommendation was to give 250 milligrams of ceftriaxone IM, which is intramuscular, and a dose of azithromycin 1 gram by mouth once. So they always said that we want to try to treat, we're giving both the ceftriaxone and azithromycin to treat gonorrhea as well as possible co-infection with chlamydia. However, the new rec is that just give ceftriaxone 500 milligrams intramuscularly once. And the reason for, before I go there, if someone is over 300 pounds or over 150 kilos, you want to increase the dose to 1 gram IM of ceftriaxone. So if chlamydial infection cannot be excluded, or the test is pending, you want to give doxycycline 100 milligrams twice a day for 7 days. So this is the reason why they changed the recommendation. So the first thing they were noticing is that we're seeing higher rates of macrolide use. So azithromycin is an example of a macrolide. So because we're seeing increased use, we're now seeing resistance to strep pneumo or Streptococcus pneumoniae, which is a bacterial infection, cause infection in the lungs. It could cause meningitis. We're also seeing resistance to azithromycin in Shigella and Campylobacter, as well as there's concerns for chlamydial resistance. And lastly, we're seeing that gonorrhea has shown resistance to azithromycin. So us ID docs, when we start seeing resistance, we like to either stop the medication that we're seeing resistance to, and or try to limit its use, all with the hope that we are able to decrease the resistance in the community. The other thing they found in various studies was that ceftriaxone actually works better if we give a higher dose. And sometimes treating gonorrhea in the pharynx can be really, really tricky. So they wanted to give the higher dose. They felt that would be better treatment. All right, so let's talk about this, which is ophthalmia neonatorum, or neonatal conjunctivitis. This was an example of a very, very cute baby who's totally normal, so I don't want you to think anything about that. All right, so just a little bit of anatomy. So the white part of the eye is called the sclera, and the lining of the white part as well as the inner eyelids is called the conjunctiva. Kind of that middle darker portion is called the pupil. And then this area right here is the iris. So neonatal conjunctivitis, or ophthalmia neonatorum, is basically an inflammation or kind of swelling redness of the conjunctiva within the first 4 weeks of life. And we're talking about babies. And this is most commonly acquired when the baby passes through an infected birth canal. So how does it look? So as you see here, this is a baby where the actual eyelids are red, they're swollen, and there's some discharge. So it will appear in the first 2 to 7 days after birth. And you can see purulent discharge. You can see severe conjunctival injection means just redness in that kind of whitish part of the eye, and the inner eyelids are red, and you can also see swelling of the eyelid. The way in which we treat this is, again, ceftriaxone. So the recommendations regarding the dosing for children has not changed. So this is what we give for kids. And in regards to the ocular prophylaxis, so if you have a baby, you know, they give two things. They, one, give a shot, which is for vitamin K. They give the hepatitis B vaccine, and you put this ointment, usually erythromycin ointment, in the eye. And they do that for all babies, at least here in the US. And that's to prevent, just in case mom had gonorrhea in her birth canal. Even for C-section babies, they all get this treatment. So, with the hope to prevent this type of infection. All right, that's all I have for you.
Thank you for watching. If you like this video, please click the like button and subscribe to this channel. Thanks.